What are the stages of pain relief? So initially we have what's called relief care. We initially want to get you some relief from the pains you're coming in with, whatever that is, like sleep issues, internal issues, thyroid issues, pains in your body, back, neck, all that sort of stuff. And then as your body starts to get more blood flow in those areas, and we get a decrease in inflammation, and we get some correction in that area, we just go to more of a maintenance. And we maintain that. And there's different ways to maintain that with our help or just by yourself. The key to relief care is frequency of care. It's similar to going to the gym. A good analogy I heard was you go to the gym once a week, you're gonna be sore, you're never gonna really get in shape though, because your body's not transitioning fast enough. So it just goes back to where it was. When you push the body and push its limits, and you do it again the next day, it'll start to come back, but then you'll meet it. And so what we do with the acupuncture is we'll treat you multiple times a week, whether it's with acupuncture or with a combination of different therapies. So acupuncture, Chinese herbs, functional medicine, and such. As your body starts to feel better, it'll slowly start to plateau out a little bit, and maybe say we're at 60%. And maybe that's all you're gonna get, but maybe not. So what we do then is we change up some things. So when things start to stagnate and we're not getting change, we change things on our end. Maybe we change how we're doing the treatments. Maybe we change how often we're doing them. We want to get you to a maintenance place where you can choose whether to come in. That's great. Other people are like, hey, I'm good on my own. I want to go out and live life again. And that's really our purpose. We love seeing patients. We love seeing their smiling faces. And I really like a lot of my patients. However, our goal here is to get you back to living. To get you in, let's see if change can be made. If we can make change, that's awesome. Let's do it the most effective and efficiently we can so we can get you back to living. We don't want to drag the process out for years and years and years. No. That's not what we do here. There are clinics that do that. We don't do that here. Now, depending on your type of, if you're coming in with something that's like long, chronic standing, we're gonna get a few little changes and maybe we wanna maintain that. But so everybody's a little different. If you're coming in for acute things or things that haven't been there that long, you're probably not gonna need as much care. The idea behind it is to really customize these plans for people, get them through that relief, get them maintaining, and then give them back to living. How do we gauge progress? Some people don't care, they just want to feel better. Other people have more of an engineering mindset and they want to see numbers and things. One of the ways we gauge projects, let's say if we're doing functional medicine and we're doing lab tests and lab reviews on you and on your blood work and such, then we get to look at numbers. We really assess those numbers, and so we can see specifically what's going on. Other times, it's more subjectively or objectively. Progress is seen either through the patient's eyes or through my eyes. As we start to make change in a human being or in our own cells, our body tries to, and our brain tries to create what's called a homeostasis. We look at that as the norm, whether it's pain or not. Like right now, my body, I don't have a lot of pain on a daily basis. 10 years ago, had tons of pain. But I can see from the way I move and the way I work, sometimes I'm like, wow, I couldn't have done that 10 years ago. But I don't feel any different. My brain and my mind is normalized where I'm at. So one of the things we can use to assess progress is what we call maybe motivating factors, things that happen in your life. And that's what we ask patients up front, like, how is your life affected negatively by this? I'm like, how is this affecting your life? Well, I'm in pain. Okay, but what aspects? And then he goes, I can't play with my grandkids. Once that starts to shift, then we made progress for this person. Every person's a little different. Some people, it's like, I just want to get back to running, or I want to just be able to like garden, or I want to be able to go for a walk down the road. I'm like, how far can you walk now? They're like, not very far. I'm like, how is not very far? So we really assess it. We'll assess people every at least 4 weeks. We can't just use numbers a lot of times. Sometimes we have to use functionality, right? So what is pain-free? What is being pain-free? So that's a great question. I worked in Eisenhower Hospital for a long time. Well, for 5 years. The hospital systems themselves have an issue with this in the pain management centers. It's really tough to assess pain for individuals because it's really subjective. I have a real high pain threshold. Some people don't. And so what is that? What does that mean? There's really no way to put a number to it. Somebody's 5 in pain is gonna be different than somebody else's 5. That's the number side. We also look and assess their emotions. If they're starting to feel healthier, generally they're gonna have more of a smile on their face. Pain tends to bring out negativity, irritability, depression, and sadness. As their body starts to shift, they'll still be coming in sometimes. I got this guy that comes in, his back's so messed up, he's a vet. He has to use 2 walkers, like he has 2 arm things. But that dude comes in and he's like, hey doc, what's up, man? How you doing? He's like the happiest dude in the world. He's like, man, you don't understand. I can function now. He can function? He looks worse than the kids that are coming in here under 30 that, oh man, my life's horrible. And I'm like, have you seen this dude over here? Like, it's almost like it becomes a spiritual thing at some level. He can function now. The other people are looking for something different. This idea of being pain-free, I don't think it's necessarily a notion that's ever gonna exist. As much as we all want pain to not be there, it allows us and reminds us that we're alive. So whether it's emotional, physical, spiritual, it keeps us on track. It is the boundary. It's our boundary in the sand that allows us to know, hey, we're on the right path, or we're maybe not on the right path. Modern day society has led us to believe all these rich people and all these famous people and all these sports figures don't have problems like us. And that is 100% not correct. I think that the idea of being pain-free is just an idea, because we're always gonna have aches and pains. The question should be more, do I have to be in continual pain at this level? The answer is no, you don't. Because we want you to be able to function, and I believe that's what everybody wants in life. They want to be able to function, whatever it may be.
What's your function?
Sometimes that means, though, reassessing what their abilities are now. An in-depth, specific question, where exactly am I in life and what do I want to attain? Because if my mind's always thinking about pain, how am I going to think about my mom's birthday gift? What we're finding as we treat more and more patients, they tell us, man, you know what's amazing? Like, my pain's still there. I still got back pain sometimes, but I can get out of bed. I don't think about it in the morning. I get up and I walk out and I do my stuff and I go to the gym. And I'm like, that's amazing. I'm not even doing that. That's great. And they're like, yeah, it's awesome, doc. Thanks so much. Is that person pain-free? No, they're not pain-free, but they're more functional and they're understanding their pain. And they're adapting to their pain. And we allow them to do that. And one of the great things about this medicine is it allows the body to reset. It takes your pain levels, it brings them down, it turns off the inflammation, and it allows blood flow in those areas, which then literally allows those areas to be more limber and more pliable and allows them to be healthy again at some level. Probably not the level you were when you were 15, when the body was still growing and being dynamic. But that doesn't mean you have to start living. I mean, I know 80, 90-year-olds that live crazy full lives. That's what we offer people, is the ability to turn their pain levels down so they can function and get the most out of life.